cell. We know if there is an infection in your site, in any part of your body, then what happens? The inflammatory cell, the phagocytic cell will reach to over there. The dendritic cell, that macrophages, dendritic cell, this will capture the antigen and try to kill that. So this is the process at your inflammatory site. But when inflammation begins, and after, if the infection is not controlled by the initial, that neutrophil and macrophages, then what will do this macrophages outside dendritic cell, they will capture the antigen and then move from the infectious site and through the lymphatics goes to the regional lymph node. In the regional lymph node, they will reach to the paracortex region where there is a T cell is located. They goes over there and then they process that antigen to the this T cell, and when the T cell get this antigen, then they will check in the different phases to understand the proper antigen has been processed, first captured, then presented, and then processed and presented. So it is processed and presented to the T cell. The once the T cell has been now will check everything and then they will try to get activated. Okay, so let's move over here. So activation of the T lymphocyte, once antigen is processed and presented to the T cell, the adaptive immune response is initiated. This interaction occurs within the secondary lymphoid tissue, and the secondary lymphoid tissue are the lymph node and the spleen. So we are talking about the lymph node mainly, spleen for the blood-borne pathogens and lymph nodes for the tissue pathogens. Okay, so one antigen is processed and present to the T cell, the adaptive immune response is initiated. This interaction occurs within the secondary lymphoid tissue. The purpose of this interaction is to generate the effector cell, which will ultimately result in the elimination of the infection. So what is the main purpose of this interaction? To generate the effector cell, which will result in the elimination of the infection. In order to generate a specific effector cell, the activation of the T cell via the T cell receptor must go through the several checkpoints. So there are the different checkpoints to understand the T cell is, the proper T cell is activated. There should be activated in a such a way by different checkpoints, because if there is abnormal activation of this T cell, then there will be the this antigen will act as a super antigen, or there will be an autoimmune disorder and other disorders inside your body. So it should be, the antigen should be captured properly, it should be processed properly, and then to be presented properly, and during the presentation everything should be checked by this T cell to ensure the antigen specificity and eventually the T cell activation. So there is the requirement of the proper roadway, proper guided activation. If there is abnormal activation or say haphazard activation, that will lead to the immunological disorder. So there needs to be several checkpoints to ensure the specific, that the antigen specificity, several checkpoints to ensure this antigen specificity and eventually the T cell activation. So this is important. Okay, now move forward. We can see over here, you can see this is the site of microbial infection. That is the microbe. If there is a blood-borne, that will reach to the spleen, and in the spleen they will be activated, they will be captured, they will be processed. First here this dendritic cell will, or say the monocyte or macrophage, inside the blood vessel, they will be actually present to the spleen, where there is that you know previously PALS, that is the T cell is located. In case of the tissue macrophages, in the tissue infection, the tissue will drain through the lymphatics towards the lymph node, and in lymph node you can see this is the antigen presenting cell. This antigen presenting cell will be presenting this to the T lymphocyte in the paracortex region, and once this presentation is there, they will be checked by this T cell, Cd4 T cell initially goes to the T cell receptor, then they will check by the Cd4, and if it is okay, then there will be the co-stimulatory signal activation, and then there will be the formation of the effector T cell, and effector T cell will be again activate the B cell and convert into the plasma cell, and there will be the formation of antibody. This antibody will be secreted in your blood and it goes to all over the body. So you have to understand the same thing. So the macrophage is, so there is the microbes infection over there, that is drained by the dendritic cell associated antigen through the lymphatic vessel. Afferent lymphatics goes to the lymph node. In the lymph node, they will be there will be what? Activation and differentiation of the T cell. Other cells will be activated as well, and there will be the activation, first activation and differentiation of the T cell, then there will be the activation of the B cell. B cell will convert into the plasma cell and the memory cell, that is the effector lymphocyte and memory cell, and this antibody they will secrete the antibody, and this antibody will be released in your blood. Then effector T cell, memory lymphocyte and antibodies enter the circulation and recirculate to protect your body. They will reach to the infectious site. This will again reach to the infectious site through the blood vessel, and then there will be the production of effector cell in the secondary lymphoid organ. This will, through the circulation, this effector T cell, memory lymphocyte and antibodies enter the circulation and recirculate to protect the body. That will reach to the infectious site, and this antibody, you know, initially they have the three function. This will neutralize your microbes or say antigen. This can activate the complement classical pathway and then kill the forming the MAC complex, and also they will increase the opsonization. So these are the procedure by which the antibody are formed. Okay, first how the antigen is captured, then process and then presented to the T cell. After T cell being presented, this will get activated. This activation will activate the B cell, and B cell will convert into plasma cell. This will secrete the antibody. This antibody will release into the circulation, and this will come back to the infection site and then eliminate the infection. So let's go in detail about it. The binding of the TCR to the mature naive T cell to the MHC peptide complex of the antigen presenting cell provide the first signal to the T cell to being activation. So what is the first signal to get activated? Binding to the TCR, that is a T cell receptor, to a naive T cell to the MHC peptide complex of the antigen presenting cell provide the first signal to the T cell to begin its activation. So there should be a antigen presenting cell. This is your T cell. There is antigen presenting cell is presenting the antigen into the MHC molecule, and the T cell is checking that molecule with the TCR. Okay, so this is the first signal. The interaction is stabilized by the co-receptors CD4 and CD8, which is bind to the MHC class 1 and MHC class 2 molecule respectively. We know the formula, rule of 8, that is CD4 will bind with MHC class 1. So what is the rule? The rule is CD4 into MHC class 2 actually. So rule of 8 is equal to 2 4 is 8, and CD8 into 1, that is MHC class 1, is equal to 8. So we know this rule of 8. If it is brought by the MHC class 2, then that will present to the CD4 cell. If it is processed and presented by the MHC class 1, then it is will be processed by the CD8 cell. This is the rule of 8. So CD4 MHC class 2, CD8 MHC class 1. Okay. This immediately association of the T cell receptor is the CD3 signals transduction complex. The interaction, the addition molecules on the surface of the APC and T cell allows for the formation of the immune synapse. So there is the tight binding. There is the interaction of this addition molecule that hold this two cell. You can see this hold this two cell and on the surface of the APC and T cell, and they allow the formation of the immune synapse. So you can see over here, this is your MHC molecule and this is your T cell. They have got addition molecule that has formed this synapse. After that, you can see this MHC class 2 protein has presented. So this you can see this MHC class 2 protein. So there will be obviously CD4 will come. This will present to the TCR. The CD4 will check that place, and once checking, there will be the addition molecule already to bind to form this synapse, and then CD4 will come and check this is the MHC class 2 or not. If it is checked, then there will be the co-stimulatory signals, and the co-stimulatory signals will be between the CD28 and B7. So we know the initial T cell receptor CD3 signal transaction complex. Interaction of the addition molecule on the surface of the APC and T cell allow the formation of immune synapse. The co-stimulatory molecules, that is the B7-1 and B7-2, which is the CD80 and CD86 on APC. This is the antigen presenting cell. Okay, so this B7 molecule CD80 and CD86 on the APC bind to the CD8, this CD8 on the mature naive cell, providing the secondary signal for successful activation. So what was happening? You have to understand this very clearly. That will be more better to understand. So there is a needed of this co-stimulatory signal, that is this is for CD8 B7, that is CD80 and CD86 and APC to bind to the matured CD8 naive cell, providing the secondary signal necessary for the activation. Under normal condition, B7 is expressed at the low level at APC. In the presence of infection or inflammation, the expression will increase, enhance the activation of the mature naive cell. Later in the immunological response, B will be bind preferentially to the CTL4 or PD1, effectively turning off the T cell response. The cytokine secreted by APC and the activating T cell themselves induce the proliferation and differentiation of the T cell into the effector and memory cell. So what we have learned, what we have discussed over here is that initially what is happening, this MSC class 2 protein that containing, this is contained on the antigen presenting cell. So they are present on the antigen presenting cell, APC. Now what happened, this APC will bringing this antigen and giving to the T cell receptor. So T cell receptor will be recognized, there will be the interaction. After interaction, what will happen, the CD4 will check this MSC class 2 is proper or not. If it is proper, the antigen is presented. Now what will happen, there will be the co-stimulatory signal by the B7 and CD28. This B7 and CD28, B7 is initially low amount on the antigen presenting cell, but during inflammation and infection, this will be regulated high. So there will be, this binding will be more. The single binding will not activate the T cell. For activation of the T cell, there will need to be this co-stimulatory signal as well. So this co-stimulatory signal will bind, and then this will be formed, this complex will be started, and what will happen, this T cell, the CD3 will send the signal, the intracellular signal, and intracellular signal, there will be activation of your this molecular and the DNA level, and what will happen, they will release this interleukin 2 and interferon gamma. This interleukin 2 is the highly potent chemokines that will act on the self receptor and cause the proliferation of the T cell. So there will be more T cell that will activate a T cell, that will activate more B cell, and then more plasma cell and more antibody will form. So the more important thing is this antigen has activated your T cell receptor, and the same T cell receptor has been proliferated. So there will be no other antigen activated. So this is antigen specific. A single antigen has made their clonal selection and expansion of your T cell as well. So one thing you have to remember, the antigen will be processed by this MSC class, this antigen presenting cell through the MSC class 2. So there will be the activation of the CD4 cell. CD4 cell, if it will be brought by the MSC class 1, then will activate it by the CD8 cell. That you have to understand. Since we are talking about the CD4 cell, so MSC class 2 protein will bring this antigen, that will check by the TCR, then CD4 cell will check this MSC class 2. If it is proper, then there will be a co-stimulatory signal. This co-stimulatory signal will be CD28 and B7, and if this both first signal and co-stimulatory signal are activated, then T cell will be activated through this CD4 will say intracellular signal that will release this interleukin 2 and interferon gamma. Interferon gamma actually enhance the macrophage and antigen presenting cell, and also they will release this interleukin 2 that will cause clonal expansion. There is more proliferation of the T cell. During the interaction, there is the release of this interleukin 1, 6, TNF alpha and interleukin 12 from the antigen presenting cell to the helper T cell to get more activated. One thing you have to understand that this B7 during activation bind to the CD28 cell, but it also compete with the CTLA4, that is the one of the molecule. If the inflammation has been shut down, then this will bind to this portion, this will bind together, and since these two are not binding, so this will be inactivated, and since these two are binding, this will actually inhibit this process and stop the activation of the T cell. So this is one of the way of activating and then down regulating the T cell. So this you have to understand very clearly. Okay, we can move forward. So several surface molecules are involved in the activation of the mature naive T lymphocyte. The first signal is recognition of the MSC peptide complex by the T cell receptor, or say co-receptor CD4 and CD8. Secondary co-stimulatory signal was B7 and CD28. This two is required. Okay. Clinically correlation, CTLA4 is an important immunoregulatory molecule in the immune system, expressed on both activated Ts and Treg cell. CTLA4 is responsible for down-regulating the immune response by competing with the B7 molecule on the APC. So this is responsible for down-regulating the immune response. The manipulation of the CD4 has important clinical implication, first illustrated by the creation of the CTLA4 knockout mice that result in the fatal lymphoproliferative disorder. Suppose if you have no this CTLA4 inside your body, then you will develop this lymphoproliferative disorder, and that was been actually found out in the knockout mouse. This deletion may also result in the several autoimmune disorder, like, okay, so there will be a lot of autoimmune disorder if this regulatory cell is not present inside your body. So there will be a continuous activation of your T cell, and you obviously will develop the immunological disorders. Now, type of regulation of CTLA4, agonist and antagonist, drug name and clinical use. So agonist can be used as the etacept and belatacept for rheumatoid arthritis and renal transplant patient. Their antagonist can be used to suppress activate your immune system. This will be to suppress your immune system. Agonist will bind to this, there will be the immune suppression down regulation. Antagonist will bind to this, and your immune system will be not down regulated, it will be actually increased. So lipimulab, melanoma, and clinical trials for several other type of cancer, we use antagonist. For agonist is used as for rheumatoid arthritis and renal transplant patient. So agonist is etacept and belatacept, whereas the antagonist is ipilimumab, that is melanoma, and clinical trial of several other cancer. Okay, so we have talked about this. There is another, the activated T cell lymphocyte will begin to produce and secrete cytokine and increase the surface expression of the cytokine receptor. The first cytokine produces interleukin-2, an autocrine signal, which induces the T cell proliferation by binding to a high affinity L2 receptor found on the same cell. We have discussed about this. This is released, interleukin-2 is released by the T cell that will act on the autocrine cell signal, and an autocrine signal, but in the same cell will be proliferated. Unlike the helper T lymphocyte, CD8 T lymphocyte secretes low level of interleukin-2 and are dependent on the helper T lymphocyte for their proliferation and differentiation. But in case of CD8 cell, they express but low level, so they will always depend on the helper T cell for their proliferation and differentiation. There is another term called super antigen. This super antigen is, what is the problem is that if it is bind, if we have talked about this, the MHC class 2 will bring this antigen over here and then present to the TCR, and this will check by the CD4, and then there will be a co-stimulatory signal, and this will be activated. But if this antigen will bind outside the group, not here, but outside the group, then what will happen? This will stimulate this T cell more and more and more. So normally 1% of T cell is activated, but by this process there will be activation of 20%, more than 20% of T cell, which is called as a super antigen. There is 20%, 20 times more activation of your immune system, and that will lead to devastating complications. Okay, so this, if the antigen is not binding into this group but on the side of the group, and that will actually lead into activation more. So super antigen are the viral and bacterial